Hi everyone, Dr. Christy Plunk here, physical therapist and owner at Joint Restoration Center in Tulsa. I wanted to give you a little bit more information, go a little bit more in depth about what our protocol includes in relieving that joint osteoarthritis. I've mentioned before that there's multiple pillars and kind of what the goal of those pillars are. We're decompressing the joint, we're allowing the joint to heal itself by providing more space, and then at the same time, we're working on stabilizing the joint and returning the motion back to what that joint was intended to move in and really reduce that pain that stems from osteoarthritis. So some of our components you've probably heard of before. It's like, well, maybe I've tried that before, or I had a friend that tried that and it didn't help for them. But I want to go through each component and explain why it's a little different with how we do it here at Joint Restoration Center. So whenever you come in initially for your evaluation with the nurse practitioner, we're going to do an x-ray. We're going to see what your knee looks like. We're going to decide on the severity of your osteoarthritis. You know, is one side kind of compressed a little bit more than the other? We're going to look at that. After that, we're going to take a look at the joint capsule. So the joint capsule is like a sac that goes around the knee joint, and there's fluid in there. And this allows, it's like oil in a car. It allows like that smooth movement of the joint. So we're going to take a look at that capsule, see if that capsule is intact. If that capsule is intact, then we're going to be able to move forward with a series of gel injections, hyaluronic acid. Your body produces hyaluronic acid naturally, so this isn't necessarily like a foreign substance to your body. We're going to use imaging to put this gel into your knee to make sure that we're getting it in the capsule. We do hear from patients that they've tried the gels before and they didn't work. But we do it differently. We use the imaging, we use fluoroscopic guidance to make sure that that gel is getting into the capsule and in between the joints in the correct space. If it is not in the correct space, then it's basically just adding more inflammation and compression to your joint. So we find that it's very important to make sure that those gels are done under fluoroscopic guidance. So that's another thing that's different about how we implement this protocol. We also will do a series of 3 to 5 of these injections. So oftentimes patients are given one injection, and different brands do have different frequency of protocols, but the gels that have the highest success rate are the ones that are a series of 3 to 5 and not just the one injection. So that's the protocol that we've adopted. Now, as you come in for those gel injections, we're also pairing it with physical therapy. So yes, physical therapy, this is exercise, this is strengthening. Everybody knows exercise is good for you, but it's more important than that. When we're trying to get rid of this joint pain, we are stabilizing the knee joint, because a knee osteoarthritis, as I've mentioned before, this joint doesn't just move forward and back like it did when you were a kid or 20 years old. Your knee now starts moving lateral. We start getting some rotation because those muscles and ligaments have kind of deteriorated over the years. So that doesn't mean they have to stay that way. The physical therapists know exactly how to build the muscle back up, to stabilize that joint and eliminate all these abnormal movement patterns. So physical therapy is a very important component of doing the gels, doing any type of treatment really for your knees. The other thing that we evaluate for is an outside offloading brace. So a lot of patients in our protocol see tremendous results even from just putting that brace on for the first time. We look to see where the joint is most compressed. So usually there's more reduction in cushion on one side of the joint than the other. From that, we're also gonna kind of just look at your gait, your body top to bottom, and see what the alignment looks like. With joint osteoarthritis, we often see that there's some deformities that start forming at the knee. Maybe you've seen somebody, or maybe you have it yourself. The knees will either go in or they start to really bow out. And that's because of the degradation of the ligaments, the cushion, and the joint space that's there. So this brace mechanically will align that joint and offload where you're getting the worst compression. Not everybody necessarily has to wear this brace forever and ever. That's not the intention. The intention is that physical therapy gets you to a point where the muscles and the ligaments are stabilizing the joint for you. We do that brace while you're doing your gels and while you're doing your PT to allow the gels and that offloading to really allow your body to heal and decrease that inflammatory process within the joint. We would love to have a conversation with you and see if our protocol and treatment plan would be appropriate for you. If you give us a call, we can ask you a series of 4 to 5 questions and see if this would be something that would get you some relief. So we'd love to talk to you. Give us a call.